Thank you very much. Good evening, all. Welcome to the second GP's Cafes of year 2024. I'm Dr. Asita. As the country chair of Spice Route, I welcome all of you to the GP session today. And today, the moderator is Dr. Praneeth Nishad. Dr. Praneeth is the MCGP holder and proud product of University of Colombo Faculty of Medicine. So, Praneeth, the screen is yours. Please introduce the speaker and start the session. Praneeth, you are muted.
Yeah. Thank you, Dr. Asita. I'm Dr. Praneeth. I'm resided in Horana City. I'm a part-time GP. I'm running the Young Doctors Movements CP the sessions organizer. Now today we are having a session on learning disabilities. It's an interesting topic done by Dr. Chamini Kuruppu Arachchi. She's a Russian basic graduate who had MD Russia and she has done her MCGP college member in GP's college. And she holds a postgraduate diploma in healthcare quality and patient safety. And she's a full-time GP in Pannipitiya Private Hospital, previously known as Pannipitiya Nursing Home. And she's one of the directors of the hospital. So she'll be having many experience in on that topic, and she'll be delivering the lecture now onwards. We'll be having a 40 minutes session and about 20 minutes discussion. So at the end, we'll be delivering a certificate to her, CPD certificate, and you also can join CPD sessions through GP's Café WhatsApp group. So we invite you to join on further sessions in near future. Thank you very much. Shall we start, Dr. Chamini?
Yeah. Thank you very much for a kind introduction. Good evening, everybody. First of all, I would like to extend my gratitude towards the College of General Practitioners of Sri Lanka and the Spice Route Sri Lankan Committee for giving me this golden opportunity to address you all tonight. Without further delay, I would like to move to today's important topic. So, do you know these people below? Any idea?
Yes.
So, can you?
That's Elon Musk.
Yeah. Do you know any like similarities or any other issues they are sharing with each other?
Most of the characters are celebrities of the community.
Okay, right. So, as a GP, I have faced this situation 5 years ago. Well, mother bought her 7-year-old son with a poor academic performance, whose mother complained about poor academic performance, which had been observed by the class teacher. Therefore, teacher wants to get the doctor's opinion regarding this child. But at that point, mother doesn't want to accept any medical condition which can be contributes towards the learning difficulty. So mother's idea was child is not studied hard enough to get good grades. In sake of teacher's request, she wants me to get my opinion whether this child is having any sort of problem. She was concerned about his grades and position within the class, and she was worried how he may face up upcoming exams, and also if she is afraid of if there is any medical issues, which eventually leads to put him under special need category, and availabilities of such assistance in government schools. Mother expects me to give her a good solution to all her burning problems as a doctor. So at that time of examination, I noticed that the child was of the opinion that he was worst academic performer in the class, which caused him distress and kind of depressed. I understood that this could affect his personality development as well. So what I did was, I took a history from the mother and I did the basic general examination. So according to the mother, apart from this problem, child is having childhood bronchial asthma. He was on inhalers and the condition was under control with the inhalers, and otherwise no significant medical history or any neurological illnesses. Surgical history and allergic history also not significant. And then I pay attention to the birth history. This child was a term baby, delivered by the LSCS, perinatal and the postnatal uneventful, birth weight within the normal range, no consanguinity, or the vaccination is up to date. In developmental history, according to the mother, no developmental delay detected earlier. Gross motor, fine motor, speech, and the social history was all normal. In family history, according to the mother, both parents are graduates. No history of intellectual disability among parents, but maternal relative who is a graduate suffered from some learning difficulties in childhood, which was not investigated and diagnosed. No psychiatric illness in the family, according to their knowledge. In social history, child was raised by the parents and the caregiver. Child is extremely attached to the mother. Household environment is calm and peaceful. And I did the physical examination as well. In that case, there's no dysmorphic features, no physical disabilities noted, weight and height within 90th centile, no neurological problems detected, and no other systemic examination. All the other system examinations were normal. What would you do as a GP if you face such incident? Any experience? Any ideas about that? Any experience? Anybody else having this kind of experience before? I know there are some doctors who work in this special units and all. They might have any experience to share with us.
Yes, I'm working in the ENT LRH, so we tend to get this type of children to get their hearing tested.
Okay, thank you. So
sometimes,
yeah, that's what I did was, first I referred this child to get the hearing test done by the ENT surgeon or audiologist. Oh, and I advise mother to get the vision checked done as well, because sometimes hearing, poor vision and the poor hearing can cause this sort of problems because they can't get the informations as much as they want to get the good performance, right? So in this child, hearing and vision results came as normal. Then after discussing with the mother, I a request to do the thyroid function test because I want to exclude hypothyroidism, which can affect the memory, and sometimes it may lead to depression and the other sort of emotional disability. That also came as normal. So as a GP, in my setup, after doing initial assessment, the child was, I suggested to mother to child may need referral to the child psychiatrist for the further evaluation or the community pediatrician. So in my situation, like the child psychiatrist was there, was available. So this is a place where I came into another challenge because in our society there's a stigma that the psychiatrists are seen only the patient with psychiatric illnesses. So the parent doesn't want to take child to the child psychiatrist because they are afraid from the beginning. In their also mind, they don't want to accept this child is having some sort of problem. And at the same time, if we ask them to go to the child psychiatrist and get their opinion, so they are a bit reluctant to go there because they don't want the society to get to know that their child is having some sort of problem. Especially the word called psychiatrist, it's a challenge. It's a challenge I got from the parents. So I have to convince them to go to the child psychiatrist because I explained them that's the best for the child. So eventually they agreed to go to the child psychiatrist, and at that point they have made diagnosis of dyslexia, and child was referred to the National Center of Children with Disability, like Arachchi Center, which is situated in the Ragama, managed under the supervision of Medical Faculty of Ragama. After initial diagnosis, I arranged follow-up care for the child with involvement of both parents and school teacher, and I have guided them to go to the education, get the proper follow-up, and to get the educational therapist opinion and training, as well as other speech therapists and clinical psychologist assessment at that. So, what is this learning difficulty? Learning difficulties are an umbrella term used for the academic problems of different origins. It consists of general learning deficits and low academic performance. So learning difficulties can be significantly impact a person's ability to acquire new skills and knowledge. Here are some common types of learning disabilities. Mainly there are 6 types. Dyslexia. It's a difficulty with speaking, reading and writing or understanding words. Actually, 7% of the population might have this kind of problem. Among all these variants, dyslexia carries 80% of percentage. And dysgraphia is a poor handwriting due to issues with the vocabulary, spellings, grammar, memory, and the critical thinking. In the third form is dyscalculia, also known as math dyslexia. These children are having disorder related to mathematics. Then the fourth is attention deficit hyperactivity disorder, ADHD. It's called. They have difficulty in focusing on tasks, organizing thoughts, and following instructions. They are very irritable sometimes. They are very distractible, and they are hyperactive. And dyspraxia. This is a motor coordination difficulties. Awkward movements, poor balance, and challenges with fine and gross motor skills are there. And the last is auditory processing disorder. They struggle with understanding spoken language, following instructions, and distinguish sounds in noisy environment. Remember that individuals with learning disabilities often have average to superior intelligence. If there is no other organic problems associated with them, otherwise they are like almost doing better if we train them or address the problem appropriately. So what is dyslexia? It's a neurodevelopmental disease which involves learning disabilities that makes reading and language-related tasks hard. It is a lifelong issue. So it falls under the umbrella of specific learning disorder. That disorder has three main subtypes. Reading difficulty we call as dyslexia. Writing disability we call as dysgraphia. And mathematics we call dyscalculia. So what are the causes of dyslexia? Actually, the exact cause of dyslexia isn't clear. However, several clues hints that how and why most cases happen. Genetics comes as first. These disorders sometimes we can see this run along the families. And the second one is difference in brain development and the function. Third is disruption in brain development and function. So there are certain risk factors they have identified so far. Toxic exposures like toxic gases and toxic chemicals like lead, manganese can lead to this sort of problems. And also lack of access to the reading materials. Children who are not willing to read sometimes can get prone to having this sort of problems. And the learning environment limitations. All these factors can lead to child to get some sort of like dyslexia kind of disabilities. So what are the things and symptoms of signs and symptoms of dyslexia? As a child gets older, dyslexia can often look alike. They have difficulty in spelling simple words. Trouble learning the names of letters. And problems telling apart letters with similar shapes, like such as D, B, P, Q. And trouble sounds out new words. Trouble associating sounds with letters or parts of the words. Trouble learning how sounds goes together, like rhyming. Mix up the position of the sounds in the word. And also, dyslexia have a level of severities. Like mild form, the people with mild dyslexia, of course, they are getting benefit and improve with the special type of learning using special type of learning techniques like with the help of educational therapists. And the moderate form, they need training as well as they might need accommodation. Accommodation means, like for example, we'll see that they are going for exam. So there will be an invigilator who can read the question. So the child can understand the question because then they can write the answer or they can give a verbal answer. So there will be some other person or the same person can state that answer if they are in difficulty in writing. In severe forms, even though we do training and we give accommodation, sometimes we are not able to get the result what we expected to get out of them. So they might need more training and the more treatment. So what are the associated features? Like this dyslexia can be associated with disorganization, memory problem, poor concentration, forgetting words, timekeeping issues, multitasking and communication problems. Also, there are some comorbidities associated with dyslexia, ADHD, autism, depression, anxiety, visual and hearing problems. So, when the child comes with poor school performance, first we can do is check for the vision and hearing problems, because it is the things which is available and free. I mean, not freely, but most of them these things are getting them from the nearest hospital. So it's available almost everywhere, and this is very non-invasive and very simple test you can do at first glance. So if there is any problem, we can correct it, and it will help the child to go ahead with her normal studies. So when we suspect the child with learning disorder, what we should do? After doing initial assessment at GP setting, we can refer this child to the psychiatric unit or the regional psychiatrist or the community pediatrician or the pediatrician. Child psychiatrists and community pediatricians are not available everywhere. So in that case, we can refer the psychiatrist or the pediatrician, which they can help these children. So they can assess and they can do like initial assessment and make diagnosis, and we can refer according to them to where the services are available. How can I help my child with the dyslexia? These children need training and multidisciplinary care at school and home. Training and training. Is dyslexia in adults treatable? Yes, adults can benefit from the treatment for dyslexia. There are programs and tools available that can help you with dyslexia-related reading difficulties, no matter what your age is. Then, my next concern, what should happen if we do not address this problem in early childhood? The definitely child will end up with the learning problems and socialization issues, poor life extreme, and depression. So, by early detection, we can prevent most of these problems. So, let's not stigmatize learning difficulties. Thank you. What I meant by this picture is these children need more care and love when they come, even after very bad record. You have to treat them very nicely. Thank you.
Chamini, thank you very much for your good presentation. This session is open for discussion. If you have questions, you can ask questions now. You may even ask questions by the chat box. Shall I make some comments?
Yeah, sure.
Yeah. At the field level, we as primary care doctors, we should identify those problems. We should abide by the principles of GP practice. That is the college main target of having this kind of GP session. So in near future sessions, we'll be having more GP sessions as this one and the earlier one. So we'll try to discuss in this session as well how we tackle like these problems. If you have any questions, what are the dilemmas as in your practice? If you face like this situation, if you face like these situations, how would you tackle these dilemmas? And at ground level, if you have uh, some kind of problems like stigma related to psychiatric problems, you can ask. So the discussion is open for clarifications.
So I would like to ask this dyslexia part, who deals, the psychiatrist or the speech therapist?
Actually, community pediatricians are there and child psychiatrists also there. Initially, after assessment, they are the one who make the they both can, or the even with the normal like psychiatrist or regional psychiatrist or the even the pediatrician can make the diagnosis of dyslexia. After they make the dyslexia, there are some assessment forms like educational therapists are the ones who train them. To train them, they are education therapists. So they are the people who are going to train them and make the management plan for the it's a should be the tailor-made management plan. They can vary according to the child situation. Did I
So
answer your question?
that means speech therapists, they don't have any role here.
No, they have. It's a multidisciplinary management. Like you have to have involved with the speech therapists, educational therapists, uh, clinical psychologist, and the psychiatrist and the pediatrician.
Okay, thank you.
Even sometimes occupational therapists also come to the role.
Won't they call general practitioner who referred the child to them? I think in the multidisciplinary team, general practitioners should also be there, right?
Yeah. Because general practitioners are the most of the time detecting this first contact person. No? So in that case, we can refer, even especially in this Ayatha center, which is situated in the Ragama, any of the doctors can refer with the letter. So they accept and they will give feedback as well most of the time.
Do they call the GP to the multidisciplinary discussions on the team?
At the moment, it's not there, I guess. But I think it's better we can suggest because GPs are the one who like follow. It's very important to involve the GP because it's help to better follow up because with the workload and the with the according to their capacity, they can't actually. What they do is at the moment in IT, they arrange sessions and they educate parents to how to do things. And with time, they get down the child and assess whether it has happened or whether there's an improvement. That's how it's happening at the moment in IT.
Thank you.
Chamini, I would like to give some information. During our training as GPs, we should get their feedback as well.
Yes.
So as GPs, we have to take over the patient and even refer him back.
Yes.
And yeah, the governance of our GP practice is like that. So
Yes.
maintaining the continuity of the patient care is our main role.
Yes.
So as one of the doctors asked, we have to take care of the patient from the start and to the end. So our continuities are not ending.
Yes.
That is a principles of the GP practice.
Yes.
According to my experience, the back referral is very poor. I don't know, this is my personal opinion. So therefore, what I do is I tend to ask from the patient what happened and things like that.
Gobit is clear.
But they
Actually, they are not sending any back referrals to us. Actually, even though they are not inviting for this MTT management, the GP. So as you said, yes, we have to go through this. Actually, they do a lot of assessment and all. They have a lot of forms and all documents, so you can go through and you can get it. That's actually what to go do that one. Even they mentioned the MTT plan and everything in the book, so you can get idea. So I used to prefer. Even now, patient can go in themselves as well. But anyway, so if you're a patient or even normally they walk in, but anyway, normally it's good to do you refer. So in the case you can follow up that. And I can say my experience actually in Jaffna, actually we have the running own development center, actually lead by the GPU family physician. Actually we have two. One is run by the department. This is a mainly run by this consultant family physician, and so another uh, private one, also the charity driven, that also run by the one of the trained general practitioner with a multiple team, multi specialty team. So actually this is, we have a lot of part on this to cater this kind of condition, because we are the people who easily identify when the patients come, or even regularly they are our patients. So even family members or whatever, so we'll get to know that. So I think even from this IIT also we should involve in future. We will try to do that. Thank you.
In my case, I have to
Chamini,
add some. Yeah, Asita. Yeah.
yes, someone has asked to explain the first slide. Yes, about the celebrities. Somebody wants an
Because
explanation.
almost all of them are having dyslexia in their life. They have gone through that. They all are all the celebrities which I have mentioned. I mean, most of them have the dyslexia, but they have all of them.
This is about the first slide, no? They're asking.
Yeah, first like they all.
Yeah.
Regarding
photos.
oh yeah.
Yeah, celebrities.
Yeah, all are celebrities. Regarding parenting skills, Family Health Bureau, with collaboration of the Health Promotion Bureau, they have started a parenting skills program to have some trainees among the public health staff. Training program will be now in near future. They will be driving as a trial. So many of the basic studies have been done with Netherlands program and Indian program. So in future, they'll be training the public health midwives and the doctors. So initial work I have also involved. I suppose in development studies, they'll try to induce the developmental studies through parenting skills. So identifying and those things will be with the CHDR, and as well as the sessions, the initial sessions during antenatal sessions, the young sessions at public health sector, there will be some changes. There is an additional part to this, Chamini.
Okay. Okay.
Praneeth?
In the chat box, there is another suggestion by Dr. Thalagala. There's in LRH they have changed the name as a developmental clinic. So to
No,
exclude the
it's called
stigma.
child guidance clinic. Child guidance clinic we call.
Guidance clinic, child guidance clinic,
rather than saying psychiatry unit, we tend to tell that I'm going to refer your child to child guidance, but not all parents they are not fluent in English, so Lama Manasika Sayana, sometimes I tend to say so. Sometimes some are there anyway they are upset actually.
Praneeth, you can upload the CPD certificate or resource person.
Hold on, there's some technical problem with
Dr.
my.
Gobit has sent a link to the chat box. Please join the GPS Cafe through that.
Yeah, you can copy the link and join the GPS Cafe WhatsApp group. So you will be having the GP Cafe's link throughout for the CPD sessions.
Thank you.
Dr. Chamini, there's the certificate of
Yeah.
appreciation
Thank
and
Dr.
you.
Chamini,
Thank you.
in appreciation of your presentation, the college has will be delivering you the certificate of appreciation of your CPD session with this certificate.
Thank you very much.
Dr.
so
Chamini,
Praneeth, thank you very much for moderating. Yes,
Dr.
Dr.
Chamini,
Saranga.
yeah, Dr. Chamini, thank you. You have opted to a very good topic actually. This is most, I mean, most GPs actually, they don't know this one, and actually you open the eyes. Thank you very much.
Thank you very much.
Chamini, thank you very much. Well done.
Thank you very much.
Thank you, Dr. Saranga and Dr. Lalit for appreciation. And I know that everybody is appreciating because we don't tend to pay much attention about these learning difficulties. We will just try to manage it somehow, and maybe some children are not managed. So thank you very much, Dr. Chamini, and thank you, Dr. Praneeth, for moderating the session. And I wish all of you a very good night and have a nice weekend. So we'll meet you again in the GP.
Thank you, everyone.
Thank you.
Good night.
Good
Good
night.
night.